Every Wednesday we catch up with our exercise physiologist, Mark Oswell, who is here to today give us a different way of looking at things and Mr. T's favourite word, pain. Look at a different way of looking at that. You had an example of a lady that actually contacted you this morning on a bit of a journey that she's been on, from knee replacement to, nope, don't need that, to jumping around.
Yeah, so unfortunately I see this too often, and I've got a fair few examples this week, but this lovely older woman who's 75, Rose, and she actually, hello Rose, because that's how she found us, she listens here. She's incredibly active, plays pickleball, table tennis.
What is the go with that game? It seems to have just...
Pickleball, it's huge.
I know it's huge.
Yeah, I know, I want to play it as well. I haven't had a go, but yeah, it's taking over the world.
Go along with Rose, she'll teach you the ropes.
Yeah, she could teach me. But she's done all of this. She's getting a whole lot of knee pain. She's got some scans, there's some arthritic changes in the knee. She's 75, ridiculously active. We could scan 175-year-old active people. They're all going to have some form of arthritis in the knee. She's turned up and she's gone, I need knee replacement. I've done an assessment, gone through the process that I do, and worked out that there was some excessive tightness down the iliotibial band, which is a fascial connection all the way down the outside of the leg that comes straight across the knee and attaches into the knee.
Could have just said the outside of the leg while we do that.
Yeah, I know, but because I've got to sound smarter than what I am. And so we did this whole analysis, and I've gone, look, your biggest issue is that old glute medius, the glute max, so the structural support up around the hips and legs. I said, oh, look, I could get you coming in doing a whole lot of stuff, but it's really simple. We strengthen the glute med. You get your husband to do some massage down the outside of the leg. Do that every day, non-stop. Do the exercise every day. 6 weeks, you'll be fine. She sends me an email. Mark, you won't believe it. 6 weeks later, I feel like I've got a new leg. And the whole thing that I want people to take out of this is that just because you have pain, just because a scan shows something, doesn't necessarily always mean that that's the trigger. I had another woman who's had 4 years of chronic back pain. You need a double disc replacement. Yeah, she's got some disc issues. When we did an assessment on her, a lot of her stuff is coming from a sacroiliac joint. Like all of these...
That one is where?
That one's in the pelvis.
Okay.
So sacroiliac joint's in the pelvis. And same thing about like learning how to use our body, learning how to activate our muscles. I got her to do an exercise which is a bridge, which is you lay on your back, feet on the floor, and you just press your bottom up off the ground. So you go up into... It's a bridge. I don't know any other way to explain it. She did that. Immediate pain straight into the back. The reason why, she was recruiting all of the wrong muscle patterns. We did some stuff that I do and got her to actually engage through the glute max. Exact same exercise, looked exactly the same, but recruited a little bit differently. She did the exact same movement pain-free.
I'm getting the vibe here, and this is a concept that's had for a long while, that like pain where you actually are receiving it, unless you sort of, like kick your toe or fall over on a
like sprain an ankle, bump a knee,
Exactly, like where you know that, well, I've hurt myself here. But pain generally is a symptom of something that's happening somewhere else.
Yeah, and chronic pain is usually an example. Like chronic pain, the easiest way to explain it, it is a fire alarm. It's a warning system. It's not that if you've got chronic pain and you're getting pain from doing particular movements, it doesn't mean that you're injuring yourself all the time. You're not making yourself worse. All you're doing is loading that joint structure, that ligament, that disc, that whatever you want to look at it, and you're loading that because of poor muscle recruitment, poor muscle activation. Things aren't doing the way that we're designed to do them. And so the body goes, here's some pain, do something about it. The problem with most people is they go down this rabbit hole of the medical model of let's scan it, let's do some passive treatment. The loads that we put through our body all day, every day, sitting, standing, walking, driving, picking up the laundry,
they all have an effect of some sort, don't they?
It all has a massive effect. Like the amount of loads and pressure that we put through our body just existing. If you don't have the capacity or the ability to fire up muscles, work, activate, track things in a proper alignment to unload the joints, you are going to get pain. So if you want to keep being in pain, keep moving like a muppet and don't do anything about it, or start to look into the causes, the triggers, the whys. There's always a trigger. You don't wake up in the morning in a huge amount of pain because your body's bored. Like it does it because it's going, there's something not working, there's something not doing things right, let's try and work out what it is. Sometimes it's a simple fix. Sometimes it's incredibly complex. I mean, it's totally individualized. It's constantly changing, and there's no one fix for all. But find the right people with the right treatment, with the right advice, with the right guidance, and you should be fine.
If they're telling you, the people, that your body is bored, you probably found the wrong people. Just to keep that in front of mind as well.
Yeah.
All right, mate, we'll talk to you next week.
Yeah, I reckon I'll be here.
Oh, it's always a pleasure. Our exercise physiologist, Mark Goswell, and he can actually cover some of your issues. If you've got a question or two, you can email him, and we'll cover them over the next couple of weeks for you. That address is askmark@2NURFM.com.